Meet Obama Ohotnicki. This is the story of the time he got osteosarcoma. Mom! Mom! Yes? My leg hurts. I've been having pain for weeks, and I've started getting swelling too in my leg. I don't know what to do. Well, maybe it's growing pains. Tell me if it doesn't get better later, and we'll take you to the hospital. Bones are the framework of the body and protect internal organs. Osteoclasts and osteoblasts help grow bones. Osteoclasts remove a section of the bone and osteoblasts replace it. But osteosarcoma happens when osteoblasts mutate too rapidly, causing a tumor. Cells divide because they need to stay the same size, because the larger the cell gets, the more demands it puts on the cell, and as the cell gets larger, the harder it is for food and waste to move through the cell membrane. Cells commit cell suicide to maintain the amount of cells in the body. But when there's a mistake in the replication process, the cell doesn't respond to the signal to commit cell suicide, which causes a tumor. Obama's pain never got better, it only got worse. So his mother took him to the hospital.
Tell me about your symptoms.
Well, my leg hurts. I have pain and swelling, and it gets worse at night, and it hasn't gone away.
I'm going to need to look at his complete medical history.
Okay.
I feel a lump. You may have even fractured your leg. I'm going to do a lab test. Hold still. Okay, you may have osteosarcoma. You show a lot of the risk factors because osteosarcoma occurs more commonly in African American adolescent males who are taller for their age. There are 800 cases of osteosarcoma in America, and 400 are in children or teens, mostly aged 10 through 12 during their teenage growth spurt. I'm going to do an imaging test to see if there's a tumor. Yep, it's probably a tumor. We're going to need to do a biopsy. What's that? A biopsy is when we remove a part of the tumor and then examine it under the microscope. This is the only way to be sure that it is osteosarcoma and if it can be treated during therapy. Yep, it's osteosarcoma.
What's the survival rate? Well, Obama has a localized tumor, which means it hasn't spread to his other organs. So the 5-year survival rate would be 60% to 80%. But with a metastatic tumor, tumors that have spread to his other organs, their survival rate would be 15 to 30%. If it has only spread to the lungs, then the survival rate would be 40%. We are learning how to remove the cancer while saving as much normal tissue as possible. We're also using internal prostheses that can grow with the bone without the need for other surgery.
We have successfully removed the tumor. But you're going to need chemo now.
What's that? Chemotherapy is a treatment option where drugs are inserted into the patient's vein or artery, which can kill the cancer cells. Chemo is often given after a surgery that removes the tumor to lower the chance of cancer to come back. Chemo is given in cycles to give the body time to recover in between. Side effects of chemo is nausea, vomiting, loss of appetite, diarrhea, hair loss, and mouth How are you sores. feeling, Obama?
I feel sick.
Well, there's only a few more rounds to go. Good news! Your cancer is gone. You can go home now.
Yay!